Assalamualaikum and hi, my name is Maria Sakma from MC248 and today I have decided to talk about anxiety disorders. As we all know, occasional anxiety is a normal part of life. You might feel anxious when faced with a problem at work, before taking a test, or making an important decision. But anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and get worse over time. So what are anxiety disorders? Let me tell you a little bit about it. Anxiety disorders form a category of mental health diagnosis that cause nervousness, fear, apprehension, and worry. Anxiety is an uneasy feeling that something may harm you or your loved one. If you have an anxiety disorder, you are not alone. Each year, tens of millions of Americans of all ages suffer from long-term anxiety. Among children, anxiety disorders are the most common form of mental illness. Anxiety disorders affect 40 million people in the United States. It is the common group of mental illnesses in the country. Only 36.9% of people with an anxiety disorder receive treatment. The American Psychological Association, APA, defines anxiety as an emotion characterized by feeling of tension, worried thoughts, and physical changes like increased blood pressure. When an individual faces potentially harmful or worrying triggers, feelings of anxiety are not only normal but necessary for survival. The nervous feeling before an important life event or during a difficult situation is a natural echo of the original flight reaction. It can still be essential to survival, such as anxiety about being hit by a car when crossing the street. For example, means that a person will instinctively look both ways to avoid danger. However, every disease has its cure. In some cases, a person can treat an anxiety disorder at home without clinical supervision. Learning to manage stress can help limit potential triggers, organize any upcoming pressures and deadlines, compile lists to make daunting tasks more manageable, and commit to taking time off from study or work. Simple activities can help soothe the mental and physical sign of anxiety. These techniques include meditation, deep breathing exercise, long baths, resting in the dark, and other than that, a standard way of treating anxiety is psychological counseling. This can include cognitive behavioral therapy or CBT, psychotherapy, or combination of therapies. This type of psychotherapy aims to recognize and change harmful thought patterns that form the foundation of anxious and troublesome. It is important to understand that anxiety disorder can be treated, even in severe cases. Although anxiety usually does not heal easily, you can still learn how to manage it and live a happy, healthy life. I am confident that advancement in the treatment of anxiety disorders will continue to bring hope and relief to the people and families and others that are affected by these disorders. Okay, bye.